Accidents can happen easily. In seconds, you can accidentally break a bone or catch the flu that can turn your whole life around. This makes healthcare an important part of life. Without healthcare, you could end up spending hundreds or thousands on procedures and appointments. While the United States might be infamously lacking in having affordable and reliable healthcare, European countries, on the other hand, seem to have a wonderful reputation for their medical care, and rightfully so. Most European countries have free, accessible healthcare that keeps their citizens happy and healthy. So whether you're planning on moving to a European country or just curious, here are 10 European countries with the best medical care. At number 10, Italy. When you think of Italy, you probably think of delicious food, stunning architecture, and eye-catching Renaissance art. However, their medical care is just as impressive. In Italy, they offer superb healthcare that is effective and affordable. See, citizens who are subscribed to the Servizio Sanitario Nazionale, or the national healthcare system in Italy, they're able to receive universal health coverage. What makes their public healthcare system so great is how flexible it is as well. This insurance covers things like medical procedures and consultations, yet most necessary medicines are completely free under the Italian system. Having said that, if some citizens prefer more private health insurance, they can also apply for that. Private health insurance allows citizens to have more flexibility and shorter waiting times. At number 9, Denmark. While Denmark might not be high on this list, this country still has a darn good healthcare system. Unlike the United States, Denmark offers free healthcare to all residents through its tax-funded, state-run universal healthcare system. Most of its residents use their public healthcare system, but they do have a smaller private healthcare sector. Danish healthcare is efficiently able to cover 100% of its population. This is very remarkable when you take into consideration that the United States has fewer than 80% of its citizens covered. Furthermore, Denmark also reportedly has more hospital beds and doctors than the United States. This is most likely because Denmark is smaller and easier to manage. At number 8, we have Switzerland. While this country is known for its eye-catching alpine scenery, Switzerland also has a very impressive healthcare system. Their citizens are required to have health insurance to cover any medical or health costs. Their basic health insurance is private, and it is mandatory for insurance companies to provide for every applicant. Health insurance covers treatment and hospitalization. However, patients will still be required to pay a portion of the costs. Furthermore, health services are administered by a mixture of public, mixed and private institutions. One of the biggest downsides to Switzerland's healthcare is that it can be a bit expensive. At number 7, the Netherlands. When it comes to healthcare, the Netherlands has a great reputation for its reliable and efficient services. In 2015, the Netherlands was actually placed on top as having one of the best healthcare systems in Europe. They also have a network of 150 primary care centers that happen to be open 24/7. Furthermore, they have over 120 general practice health centers and 94 emergency units with surgery facilities. More so, in under an hour, most citizens in the Netherlands can be transported to a casualty ward. Similar to other European countries, health insurance is mandatory in the Netherlands. It is partly funded by taxes and patients. With that being said, most hospitals in the Netherlands are private, but there are 8 teaching hospitals that offer advanced treatments. However, in general, there are benefits to its healthcare system. The Netherlands healthcare system offers reliable services, prevention, patient information, and patient rights. Number 6, Luxembourg. While Luxembourg might have a smaller healthcare system, they still offer plenty of impressive resources. Luxembourg's system is state-funded and is able to offer medical coverage to every citizen. Almost 99% of their citizens are able to be covered under the state healthcare system. This country's healthcare system is based on 3 important values: compulsory health insurance, patients having free choice of a healthcare provider, and a necessary agreement of providers in the set prices for the system provided. All of their hospitals are public and offer a wide range of high-quality care. However, it is significant to note that only larger hospitals offer emergency facilities. At number 5, Austria. Not only is Austria gorgeous, but it also offers incredible healthcare services to its citizens. Austria's public healthcare system services are available to everyone, which includes expats and tourists. However, if some citizens want more premium services and can afford them, they have the ability to subscribe to private health insurance. Private health insurance offers more flexible visiting hours and gives the patient the option to be treated by a private doctor. However, the public healthcare system is still very efficient in comparison. The public healthcare system has plenty of qualified, professional doctors and as well a great infrastructure. With that being said, there are some negatives to Austria's healthcare system like long wait times, strict schedules, and a somewhat bureaucratic system. At number 4, Norway. Norway, also known as the land of the midnight sun, offers a healthy, long lifespan for its citizens due to its efficient healthcare system. Norway has universal healthcare that is mostly funded by general taxes and by payroll contributions that are split between employers and employees. Their public hospitals are funded by the state, and anyone over 16 has to pay a fair amount as a deductible charge each year. While Norway does have a large network of impressive public hospitals, they do also have more expensive and private clinics available with a higher standard of care. If you're an expat, it is mandatory that you participate in the national insurance scheme and allow them to obtain public health system. The only downside is that Norway does have quite a long waiting period. At number 3, Germany. Since Germany has one of the oldest public healthcare systems in the world, it is quite remarkable how well its healthcare system has aged. Based on official data, in 2017 it was reported that around 70 million Germans are insured under statutory health insurance. Currently, Germany has one of the highest expectancies in the world. Furthermore, they have high doctor-to-patient as well as high government spending on health. It is also important to consider that by law, Germans are required to have health insurance. Due to this law, most Germans tend to choose the public insurers. However, there are private and premium insurance available. If you're an expat coming from within the European Union and the European Economic Area, you are allowed to transfer your Social Security and health insurance to Germany. Yet citizens on welfare are able to have their health insurance covered by local authorities. Number 2, Sweden. The highly efficient and effective healthcare system in Sweden has allowed them to have some of the lowest infant mortality rates and the highest life expectancies in Europe. Even the average Swedish man was ranked as having the 4th highest life expectancy in the world, which is incredibly impressive. The average patient tends to only pay 3% of their medical costs, but they usually have to pay for their own prescriptions. However, this is only for a certain amount, because afterward the government tends to take on full responsibility. Their state-funded healthcare system is funded by taxes and only needs a trivial payment by the patient. However, its waiting periods can be quite long, but there are a few systems in place to help quicken the pace. And at number 1, France. With an average life expectancy of 82 years old, France has some of the best medical care in the world. Currently, they have some of the lowest numbers of preventable deaths and the highest national spending on healthcare in the continent and the world. Furthermore, they also have a very efficient, high doctor-to-patient ratio. Most primary healthcare is given by a network of roughly 23,000 general practitioners. So not only does France have an effective system, but their medical care is also very affordable. When it comes to major surgeries, most patients will be reimbursed for most of the costs by their health insurance provider. French residents are required to have health insurance. This could be private or public health care depending on what the resident wants. Usually, France's state healthcare insurance will be able to cover around 70 to 100% of costs for things like hospital expenses and doctor appointments. When it comes to healthcare, Europeans do not play around. Europe is already famous for its accessible and affordable healthcare that keeps its citizens thriving, but I bet you did not know how in-depth their medical care really is. From France to Austria to Italy, these European countries take their healthcare very seriously. So whether you're planning on moving to Europe or just want to learn more, hopefully you found this video very informative. Feel free to tell us which European country you want to visit in the comments. See you next time!